Welcome back, friends. I'm really excited to share with you some new information today about having a healthy pregnancy, how to thrive during pregnancy. And I have with me my new friend, Dr. Kayla Schumacher. She is a chiropractor and a functional medicine consultant living in Minnesota with her family. She has 2 kids at home and another one on the way, correct?
Yes.
So you're 29 weeks pregnant, or is it 30 now?
30.
30 weeks pregnant.
Tomorrow.
So she is definitely in it, living this real life. And she has had some experiences in her life that have taught her the importance of the foundation of nutrition in terms of having a healthy lifestyle. I know I talked to you guys about this a lot, that you want to come to me and you want to know what essential oil you need or what herb you need to fix the problem, when really the foundation of everything is nutrition. So I'm really excited to have Dr. Kayla here. And Dr. Kayla, would you mind sharing your story with us? How did you get into what you're doing right now?
Yes, absolutely. Well, from a young age, like I think I was 4 or 5, my parents took my siblings and I to the chiropractor. So we've always been in that natural health realm. And I struggled with a few digestive issues when I was just before, I don't know, I think I was like right after high school.
Okay.
And nothing was working. Nothing was taking it away. I knew that going the medical route, I'm going to preface and say that there's a time and a place for that.
Yep.
But I knew going the medical route was just going to cover up whatever was going on.
Mm-hmm.
And so I actually, when I was in college, I changed my major and I decided to go into chiropractic because I knew I could help the whole realm of what I wanted to work with. But it wasn't until actually after chiropractic school that I sought out functional medicine for my own health. And I had kind of done a little bit of it. You kind of dabble in all the health. I'm kind of a nerd when it comes to health because I love, I'll try anything.
Yeah, me too. Like you're a biohacker and you want to try the devices and all of that. Yeah,
give me the foot soaks, give me the, all the crazy coffee enemas, seriously, give me all the crazy stuff.
Yeah. Samesies.
Yeah, I love it. And it wasn't until I started I had never had blood work done. And when I saw this functional medicine doc, it just made sense. This is what's going on currently in your body. There's no guessing. There's, no trial and error. This is what's going on in your body. This is what needs to be done. And so I had heavy metal toxicity. I had major adrenal fatigue, which I don't even like to use that term anymore, but just lots of things. I was getting headaches, just so tired all the time. And for somebody who was pretty on point, there's so many different realms of nutrition with my nutrition, health conscious, basically I wasn't eating processed foods and a ton of sugar, I was like, why is this happening? What's going on? So that led me to, I was still in chiropractic, but that led me to want my own functional medicine practice because I was like, people need to know, people like me, I would have women come to me all the time. You kind of attract what you're going through.
Yes, you do.
And your clientele, wants to be my clientele are, moms and young women and, even some middle-aged women and, young moms that are I'm just tired and, want to do the best thing for their health and for their family's health. And so I'm like, people need to know this. This makes sense. Why don't we stop looking at all of the different supplements out there and just taking a fad supplement when you don't even know if it's really doing anything for you.
Right.
So that's where I started with functional medicine. And I feel like I've kind of evolved with what I want for my clients since I started.
That's amazing. And actually, there's so many similar things in your story to my story, doing everything right and not getting the answers that you need and not getting the results that you need. But there's a lot of people that don't know anything about functional medicine. In fact, for some people that might have been the first time that they've ever heard that term. So can we just take a big picture view? What is functional medicine?
Yeah, no, that's a really good point too, because I feel like it's a little bit intimidating And the best way that I can describe functional medicine is really blood work. I mean, lab work.
Okay.
Like that's really the basis of functional medicine.
Mm-hmm.
And really figuring out, I call it your biochemical individuality.
I like that.
So your biochemical uniqueness, what's really going on in your body at the current moment.
Very cool.
And then working with, all of the blood work basically is the foundation of where I go.
Mm-hmm.
But I've taken it a little bit in a different direction with, and I'm sure we'll get to this too. If I'm jumping ahead, just say slow down.
You're perfect. Keep going.
But so I started working with my functional medicine doc. I think it was back in 2016. I think it was maybe 15 before I got pregnant with my first son.
Okay.
And it kind of felt like I was just using a supplement cabinet like a medicine cabinet. And I knew that's, there's a time and a place for supplements just like there is medication, but it wasn't really until I left that functional medicine doc as my sort of mentor and found somebody who does balanced protocol is what it's called. Mm-hmm. And really the foundation is working with your environmental factors. So your air, water, your light source, sound, electromagnetic frequencies, and nutrition.
Okay.
Because once I'm all about like going back to the basics and building the foundation.
Yep.
And if you think about it, you could, if you're breathing in super toxic air or drinking terrible water, both things that you need to thrive and survive in this world, like you can be taking all of the supplements you want and you can be eating all the organic broccoli that you want and all of the good stuff. But if your environment that you live in is toxic, you're never going to get healthy.
For sure. Okay. So with the balance protocol, is there like a standard set of blood tests that you're doing with people? And then is there a standard way that you're looking at those environmental factors with them?
Mm-hmm. Yes. So I start with one of them is called a NutrEval plasma. So it's a blood and a urine test. And it's really testing your mineral levels, antioxidant, nutrient markers, tells me your metabolic status. So how you should be eating, what % of protein, fat, and carbs you should be getting on a daily basis. Really, that's like the gold standard of like where I start with every single person that works with me. Okay. The other one that I really encourage and strive for is a food sensitivity test. Mm-hmm. So there's a certain one that I do. Okay. For sure. And Perfect. If people choose to work with me through their 6 month program, I teach them ways. There's different meters, again, I test everything. I don't guess anything. So there's different air quality meters, electromagnetic frequency meters, sound meters, things that we utilize within your home to really make sure that you have the best environment.
Oh my gosh, I love that. So those are all things that I harp on a lot as well. I mean, people don't even realize how background noise can raise their stress levels.
I know. Yep.
So with the 6 month program, is it just women that are pregnant or trying to conceive that you're working with, or is it any woman?
Yep, it's any woman. Yep. Okay. So really, in fact, I've had one woman who I guess was trying to conceive, mm-hmm. Or she had, but she was having trouble getting pregnant, I think a third time. But a lot of women that come to see me are like thyroid issues. Mm-hmm. They're really struggling with the thyroid, and they've been told by so many doctors that that's the issue. But I had one woman who worked with me from the beginning of my functional medicine journey. And she continued with me when I kind of moved over to the new model that I'm doing. But she had major thyroid issues, tons of skin, hair loss, all of that. And so we did the NutrEval plasma on her, and it was just crazy, the nutrient and antioxidant levels that were off. So, we're never going to correct her thyroid if that's where we start and we don't look at the foundation of what's really going on. Because her thyroid's not going to, we can pump all of the good things at the thyroid, but if the rest of the systems are shutting down, it's not going to help.
Yep, the whole thing needs to be working together in concert, just like a symphony.
Yes.
That is a really awesome program. And it's really fun to hear stories of women that you've helped. So let's get into pregnancy, because that's what I wanted to focus on today. That is not an area of specialty for me, but it's an area that I get a lot of questions about, because
Okay.
I think, tell me if you agree with this or not, I feel like as women, we're almost taught to be afraid of our bodies,
Oh,
and
yeah.
then to be afraid of pregnancy, and to be afraid of everything that has to do with that. And I feel like the way out of that is to begin to empower women with more information about how they can actually thrive during this thing that's actually very natural that your body's made to do. So let's get into some of the pregnancy stuff. And let's ask this question first. What do you wish every woman could know about having a healthy pregnancy?
So this isn't necessarily functional medicine related, but I tell all of my patients in the chiropractic office this, that I wish that every single woman would lower their expectation.
Hmm.
And I mean, we're in such a society today where, everything's online, right?
Mm-hmm.
And this is going to go along with, the rest of what you and I teach our clients all day.
Mm-hmm.
But we have birth plans. We have an ideal. We have a way that, for some, the picture perfect birth might be a natural labor in the tub with no epidural and medications, and she has a C-section in a hospital.
Yeah. And then she feels like a failure.
100%.
Yeah.
And, and we don't talk about birth enough in our society. We don't talk about miscarriage enough in our society.
Mm-hmm.
And so I feel like if we just lower our expectations, and just so much of it is out of our control. That's why I try to empower women on the daily with functional medicine, with the chiropractic, that like, you have a choice, you have a voice. But if your birth plan doesn't go to plan for some unknown reason, or some medical reason, and you're healthy and your baby's healthy, then that's okay.
Yeah, for sure.
Because we just try to, what supplement should you get this, what supplement should I be taking for pregnancy? What food should I be eating? What oil should I have? What should or shouldn't do? And it's just all day long we can consume ourselves. And then at the end of the day, we're still not happy with our pregnancy and enjoying it because we're worried about it.
Totally. And then how does that set you up as becoming a parent? So if you didn't live up to your birth plan, how are you going to live up to your ideals as parenting? And again, I think if there's anything that parenting teaches a person, it's that how you think things are going to go isn't necessarily how it is going to go.
You have to roll with it.
You have to roll with it. I love that. Okay. So let's talk about women that are trying to conceive. Mm-hmm. Are there any specific functional tests that you recommend for women when they're thinking about trying to conceive?
So one of the most frustrating things about my role in functional medicine is my response, and that is no. Because it does not matter. And this is really hard for people because we want that pill. We want that quick fix. We want that it taken care of right away, right? Mm-hmm. And I had to learn this as a practitioner too. The biggest thing is that no matter where you're at in your health, you have to go back to the basics. And you have to make sure that your foundation is strong and healthy. Because again, you could be eating all of the healthy foods, and if organic, if broccoli, not even organic, I don't care about organic, if broccoli is a high reactive food on your food sensitivity, what are you doing? So same thing. So with infertility issues that I see, it's where are your nutrient, antioxidant, and mineral markers at? Can your body even support a pregnancy right now? Mm-hmm. And how do you know that? So the NutriBio plasma, 100%. And I don't, I just order it from the lab company. They don't know me.
Right.
But it's just, you have to set the foundation and build the foundation first, or it's not going to work out. You're going to continually be going back, trying to fix things. It's like people with hormones. I get a ton of hormone questions. Mm-hmm. I know my hormones are out of whack. Okay, they might be, yes. But before we start doing anything with hormones, we have to go back to the foundation.
Yeah. So isn't that just a reflection of our American mindset that it's always about the goal that we want to achieve?
Yeah.
when really we need to step back and say, whether or not I'm trying to conceive, I need to be taking care of myself. I need to be looking at those foundational things.
100%. So I always tell women who are starting, because that's what I did. I started before I knew I wanted kids. I started functional medicine. I did my blood work. I went through the protocol. I went through and built my foundation so that I knew that I could have a healthy pregnancy. Like, I think I'll never forget my functional medicine doc at the time. My progesterone was really low. And he said, well, you know, if you were to get pregnant right now, you would be able to get pregnant, but you wouldn't be able to sustain your pregnancy.
Yep.
And you know, that is, you know, again, like miscarriage, it's such a common thing. Yeah. And it's, you know, it's hard. But, you know, so I always tell my women, if you're thinking about getting pregnant, do this test, see where you're at, build up a little bit, and you'll have a better chance.
So having said all of that, what are your thoughts and feelings about prenatal vitamins?
Oh, well, drastically have changed since my last pregnancy.
Oh, okay, tell.
So so this is my third boy,
okay,
that I'm due with here soon. But you know, you think that it's just like a one thing and you can take a prenatal vitamin and you're going to be good and everything's perfect. And so I did that with my first two, took my prenatal, still, you know, followed my, you know, healthy nutrition. Like my first pregnancy, I was like on point with everything nutrition. I'm pretty sure I didn't eat a piece of sugar until like the last trimester when you're just like ready.
Yeah.
Second, I leaned up, like, or I lightened up a little bit on the nutrition. But with this pregnancy, I did my NutriVal plasma. I saw where my levels were at, what I was missing versus taking just a one-size-fits-all prenatal, because again, that doesn't go along with your biochemical individuality. I might need something more versus somebody else might need something more of a different mineral or whatever. So I suggest, like, the gold standard for me is doing the NutriVal plasma, seeing where you're at, seeing what minerals your body needs supported with.
Okay.
Yeah.
Okay. So then when we're talking about the body, actually, once it's into pregnancy, we have the 3 trimesters of the pregnancy. Is it going to change how we support our body nutritionally in each of those 3 trimesters, or is it basically the same through the whole thing?
I mean, it's pretty much the same through the whole thing as far as, like, you know, because I could do another NutriVal plasma halfway through my pregnancy, beginning, halfway. But the reality is like your levels are naturally going to be lower because you are growing another human. Yep. But really, I wouldn't say nutritionally things change a lot. I would say that the foods that your body is craving change a lot. Yes. So, you know, at the beginning, we want carbs, right? Like, I mean, I could have eaten pasta every single day. Things that are a little bit lighter on the system. I didn't want the protein right away.
Right. Yeah.
You know, and so your body's building up that energy. So it wants all those carbs, right? You know, second trimester, I feel like it's just like, you're just cruising, right?
Yep.
And then third trimester, you know, as you get, you know, further along too, like, I always recommend things like stews and cooked vegetables and, you know, things that are a little bit easier for your body to digest and utilize, because, I mean, my mentor said it best to me the other day, you kind of have a parasite in your body. Right? You know, because it's something else that's taking all the nutrients and everything from you.
Yeah, for sure.
So, you know, and I'm not going to sit here and tell you that I am perfect with my stuff either, because I actually called my mentor and I was like, I need help. My iron was low on the blood work that the birth center did. And I'm like, but I'm struggling eating. I'm really having a hard time eating. I'm, you know, when I'm at the chiropractic office, I just get busy and I don't like to stop to eat. Yeah. And, you know, and I'm like, but I know what to do. But when it comes to your own health, I feel like I lose everything that I would tell, you know, you sitting in front of me. You know, so I'm working on scheduling it in. I have to have something, you know, ready for lunch. I have to eat smaller meals. the stews and, everything that I just said.
Yeah.
So but it's hard. It is
So
really
listen,
hard.
folks, this is a practitioner herself saying that she needs mentorship for her own health when it comes to things that she is
Oh
actually an
gosh.
expert in.
I mean, coaches need coaches,
Absolutely.
it's, yeah. Oh, for sure. Yeah. And, like I said, when it comes to my own health, sometimes or like my kids, I'll call my mentor. I'm like, I forgot everything that I knew and I don't know what to do. Like, is my kid going to be okay? Bring it
Okay,
back.
excellent. Well, we have to adjust our expectations and we also have to look for ways to support ourselves. It doesn't matter how much of an expert we feel like we are. So let's talk about some of those environmental factors during pregnancy. So how do we thrive environmentally during pregnancy? Is there anything in that realm that you've learned that's really surprised you or that's really made a difference?
I would say the biggest thing, especially right now, like, I mean, you're in North Dakota, I'm in Minnesota, is getting the fresh air,
Mm.
getting the vitamin D.
Yep.
Those are the hardest things because, we could stay hunkered in all winter,
Yep.
which, could last 6 months.
Yep.
And, around November-ish, we don't get the natural vitamin D that we are used to.
Mm-hmm.
So I teach my clients how to come up or how to make their own vitamin D lamp. So sitting in front of that versus taking a supplement. The vitamin D lamp actually, the vitamin D that you get from that lamp lasts twice as long as taking a supplement.
You can make your own vitamin
Yes.
D lamp?
Yes. I'll send it to you.
This is
Um,
fascinating.
Yes. And so sitting in front of that, you're sitting in front of that until you get just the touch of red skin, and then turn over, go to put it on your back. So getting that, because we don't get that. And then I would say the biggest thing when it comes to air quality is letting fresh air in the morning, a minute, close the windows, let it back, open the windows back up at night, just a minute. And then I use an EnviroCleanse air purifier system.
Okay.
And I turn that on a couple of times a week. But, and that's if I do that to circulate the air in my house, but getting outside, even if it's 5 minutes a day, like I have to bundle my little boys up and we go outside, and I'm usually the one that's like, okay, you guys, I'm freezing. We need to go inside. But just getting that fresh air, and making sure that the environment that the air that you're breathing in your environment is healthy. Even at work, people forget a lot about where they work, that needs to be healthy too. So get some plants in your house and, at work, those kinds of things.
Connection to nature is what that is. And it's something
100%.
that we are all deficient in, especially in the north in the winter.
Yeah.
Okay. And so then how has each of your pregnancies been different nutritionally? Have they been different nutritionally? And if so, how?
Well, I would say kind of like what I just touched on a little bit. Just, the first pregnancy, I didn't know what I was doing. I was super excited. I was very conscious, I would say.
Yeah.
So I would not let, I was super conscious of what I ate. I still gave into the cravings because that's pregnancy and that's life.
Yeah.
So the first two were like that. The second pregnancy, I probably added a little bit more, was a little bit more lenient. But then this pregnancy, I would say, like I said, with the lab testing, this was the biggest difference, was not taking a prenatal vitamin and actually being okay with it. Cause it's a little that's just take your prenatal and everybody thinks that you're gonna be good.
That's what your doctor tells you to do when you go in for your checkups. You're supposed to do that.
Or even my iron was low on my 28-week test. And so they're like, this is what we recommend, but I don't like to supplement with iron. And I would like to get all that from the food instead, which I need to be doing anyways. It's low because I wasn't eating enough. And so, my mentor was like, you know what? It's not about you. I was like, you're right. Okay. Okay.
Excellent. I like this mentor of yours.
Yeah. But you sometimes you just have to reel it back in.
Yeah.
And I feel like, with women and nutrition, just, do the best you can and reach out if you need help. Find somebody to help you, because there's so many blogs and people that, you'll resonate with this, but my biggest thing too, when it comes to taking a supplement that you read off of a health blog, is they don't know you.
Right. Yep.
they don't know your biochemical individuality. They don't know what you're going through. They don't know the environment that you live in.
Mm-hmm.
You know, turmeric could be the worst thing for you.
Yep. Yep. For me, I have MTHFR. So like there's certain forms of B vitamin that are very bad for me and that have given me problems. And if I hadn't known that, I wouldn't be able to make that individual choice for myself. So I think having that information, having that testing, doing that biohacking is really, and I feel that it's an adventure for people.
Yeah.
This is not about the things you're doing wrong. This is about the things you get to uncover that are going to
Right.
give you leverage in your life.
And longevity,
Yeah.
like, I mean, I think the biggest turn away for people with functional medicine is that it takes a while.
Yeah.
Like my program is 6 months and that's just the foundation.
Right.
That's building the foundation, but people have to understand that it didn't take you 6 months to get to where you are.
That's right.
And to be living in the crap and the toxins and all that.
Mm-hmm.
So
Mm-hmm.
patience with functional medicine, because, you could go have the surgery. That's fine. You could go take the pill. That's fine.
Mm-hmm.
But if you want the issue resolved, you got to put in the work.
Well, I think after hearing all of this today, Dr. Kayla, a lot of people are going to want to connect with you and work with you. So where can people find you?
Yeah, well, social media.
Social media. So Dr. Kayla Schumacher.
Yep, just Dr. Kayla Schumacher, or drkaylasumacher.com.
Okay.
I offer kind of like what you do to a free discovery call.
Mm-hmm.
So we can chat about what's going on. And, I don't work with everybody. So the discovery call is nice to kind of filter out, like, is this the best fit for both of us?
Mm-hmm.
And really see what we can do.
Okay, so drkaylaschumacher.com, and I'll have that in the show notes. Thank you so much for sharing your knowledge and your experience today. We appreciate it so much. And I know that there's so many women that are almost like just burdened with the overwhelm of the questions that they have around pregnancy. There's so much expectation, even culturally, about how this is supposed to be now. And I just think boiling it down to the foundation of let's look at what's actually going on in your body is the only thing that seems to make sense to me at this point. So I really appreciate what you're doing in the world, and have no fear about contacting Dr. Kayla about that discovery call. I know that she's going to give you amazing help and service and support. And of course, as always, please comment, like, subscribe, hit the notification bell for this vlog. And if you're listening on your podcast, I do appreciate those 5-star reviews, and we'll see you next time.